We want to make a difference. We want to help people achieve higher levels of health, both dentally and overall health-wise. So what we find is what my son, at an early age, he's 5 years old now, even though he's been brought up with all this correct data, we still see that he's exposed at either daycare or at school to different factors that could jeopardize the health of his teeth. But we try to give him some tools so that he can overcome some of these things that he's exposed to socially that may continually break down his teeth. You want to say some of the things that you do on a regular basis? Tell me what you do.
Sometimes I have to brush teeth after I eat candy so my teeth don't fall out.
Wow.
Now, how often are you eating candy?
In a day. How often? Once, 5 times, 10 times? Yay! And why is that, doctor?
That's a great point. What we try to do, first of all, I'm not advocating eating any candy, but we do see that it's one of those things that sort of slide into the family's dietary program. But what we would like to indicate is that if there is going to be any sugar or candy or anything that has a higher concentration to cause an effect on the teeth, we would like it to be confined to only one time during the day, a very small portion of the day, so it isn't done several times throughout the day to make the saliva hold on to sugar throughout the whole day and bathe the teeth to make it be predisposed to cavities.
Good. And Max, what do you do after you eat candy? Do you do anything to get some of it? What do you do?
Brush your teeth.
Oh. And what if you don't have a toothbrush? Let's say you're out with Dr. Regni and your family, and you're out eating dinner and you have something like that and you don't have a toothbrush.
You mean you're eating candy?
Yeah, just once a day and you're out for dinner and you don't...
And after dinner you should brush your teeth.
Good. What if you don't have a toothbrush? What could you do?
Probably go out to Maggie.
What would you suggest, Dr. Regni?
Well, we've suggested to rinse vigorously with water. And we have Max usually be with a toothbrush, but if not, we have him rinse out vigorously with water to get rid of that sugar concentration and dilute any potential of those sugars turning into acids to cause cavities. Again, one of the biggest things we've seen on the rise is that the children coming into us are having tremendously more cavities, and some of them are so deep that they're requiring root canals at the age of 2 and 3 years old, which is absurd.
Wow. Well, this is going to help. This one tip will make a huge difference. Thank you very much, Dr. Gerald Regni and Max Regni. You really helped us and made a difference. Thank you.